Hello, guys. Good morning, good afternoon, good night, whatever time you're watching this. Our team today, we're going to show you about the insertion of a urinary catheter. Our team is JOANA, NEREYDA, ARMENTA, Garcia, SOFÍA, GUADALUPE, CHAVEZ, RAYOS, Alison, JACQUELINE, Garcia, CORONADO, and me, GISSELLE, JULIANNE, LIMAS, FLORES. Nice to meet you. And starting with the index, we're going to see the objective, introduction, definition of the procedure, nursing fundamentals, equipment, materials need, a script, step-by-step explanations, and this is going to have like introduce yourself, identify the patient, and a little explain about the procedure, gain the patient consents, carry out the procedure, and almost finishing little conclusions and the reference. Starting with the objective, our objective is to provide nursing students, because we're still being nursing students, with a clear and detailed understanding of the proper process for inserting a urinary catheter, highlighting the correct technique to ensure patient safety and the effectiveness of the procedure. And a little and a big introduction. Urinary catheters are usually inserted by a doctor or a nurse like us. Urinary catheter insertion allows us to drain, decompress, obtain a specimen, and irrigate the bladder. This will allow us to treat urinary retention, bladder outlet obstruction, evacuate clot, and monitor urine output. And a little explanation of urinary output is a sensitive indicator of volume status and renal perfusions and can be the key to appropriate management of ill patients. And then the technique requires precision, anatomical knowledge, and proper asepsis to avoid complications such as urinary tract infections. So the nursing role in this procedure is essential, as in addition to inserting the catheter, they are responsible for correctly selecting the appropriate catheter type and size, monitoring the patient during the procedure, and providing follow-up care to prevent complications.
Hello, my name is Alison, and today I will tell you a little about the urinary catheter. I am the fourth semester of the nursing career. Okay, but we define what is the procedure. The definition is that urinary catheterization is an invasive technique that involves an accepting the introduction of catheter into the blade through to the uterine means to establish temporarily permanent or intermittent drainage pathway for diagnostic therapy purposes. Bladder catheters are flexible tubes made of various materials and diameters with specific characteristics depending of their shared use. Some are retained by a balloon inflated with stirred water, which keeps it in the plate.
Nursing fundamentals. Prioritize antiseptic technique. Principle prevents infection by minimizing the introduction of microorganisms into the urinary tract. The urinary tract is normally sterile, and catheterization introduces a foreign object that can allow bacteria to enter, potentially leading to urinary tract infections or UTAs. Patient safety and comfort. The principle here is that it can guarantee the patient's safety by ensuring that the procedure is conducted in a manner that minimizes discomfort and potential harm. Catheterization can cause physical discomfort and emotional distress for patients. Indications for catheterization. The principle is that catheterization should be only performed when medically necessary. Overuse or inappropriate use of catheters can lead to infections, trauma, and other complications. Then we have the nursing fundamental of reduce the risk of infection of the UTA's prevention. The principle here is that the UTAs are common complications of catheterization and they can cause significant morbidity and complications. Then we have monitoring and documentation. The principle here is that when we document the procedure and monitor the patient's response to catheterization, ensures continuity of care and allows for the identification of potential issues, such as an infection, trauma, or change in the urine output. Then we have the post-procedure care and education. The principle is that proper post-catheterization care reduces the risk of infection and ensures the patient is comfortable and is informed.
The materials or the equipment needed are equipment for genitals, hygiene, and 8 to 10 French Foley catheter for the children, and 12 to 16 French for adults. Gauze, sterile swab, antiseptic solution, steel gloves, 5 and 10 milliliters, steel syringes, steel water, kidney trials, bed pen, floor lamp, or examination plan.
Hello everyone, my name is Joanna, and moving on with our presentation, we have our script. The script the script consists of a few points that we may check in during the procedure, that we may cover during the procedure. First, we have an introduction. We'll say something like, "Hello, good morning, Ms. Diaz. My name is Jocelyn, Joanna, Elliot, Alison, Giselle, and I will be the nurse assisting you today. How are you feeling? I need to ask a few questions if that's okay with you." We have then the patient identification. We have to identify our patient. We'll ask for the full name and date of birth of the patient. Can you tell me your full name and date of birth, please? May I check your ID bracelet to confirm this information? Thank you very much. We'll ask about allergies, current medication, illnesses, or surgeries. If we have the chart of the patient with us, we may also check that. But if the allergies, medication, or illnesses are related to the pathology that is making the patient to need the catheterization, the urinary catheterization, we have to check it again. To do a briefly explanation of the procedure, we'll say, today I'm here to perform a procedure called urinary catheterization. It consists in placing a small tube into your bladder through the urethra so we can drain your urine. First, I'll make sure you're comfortable and in a proper position. Then I'll clean the area around your urinary opening. I'll insert the catheter, which is very thin and flexible, into your urethra. Once it's in, we'll drain the urine into a collecting bag. The procedure is quick, but you may feel some discomfort during the insertion of the catheter, which should go away once the catheter is properly placed. If they understand, do you understand what I just said to you? I will be explaining everything as we go, so feel free to ask anything. We'll ask for the patient's consent. Before we start, it's important that I have your permission to proceed. Do I have your consent to perform the procedure? If they say yes, excellent. I will be preparing the equipment that we need. Now for the procedure itself. Now that I have everything we need, I will go to wash my hand to practice hand hygiene and close the curtains or the door to give you some privacy. To place the patients in a proper position, could you lift and flex your knees, please? I'll place this underpad and urinal under you and also cover you up with this blanket to give you privacy. I'm going to clean the area around your urinary opening with the soap and warm water or antiseptic solution. This will prevent any infection. We did that with non-sterile gloves, so we'll say something like, now I'm changing my non-sterile gloves for sterile ones and preparing for the insertion of the catheter. I'll place this drape and a sterile drape to expose the area, only the area that we need. Now I'm going to touch you to separate your labia so I can insert the catheter. I'll introduce it around it like 15 centimeters, and this also may feel uncomfortable, but it should only take a few moments. Now that we enter, the catheter has a balloon in it where I'm pushing sterile water, and this will help to prevent the catheter from coming up of the bladder. Then then after that, I finish connecting the collecting bag to the catheter and securing the catheter to the inner side of the patient. We'll ask how they're feeling so far, if they're uncomfortable is normal and should get better soon. Well, I'll make sure the catheter is secure and you're comfortable, as we said. Please let me know if you feel any discomfort or need.
Well, hi again. I'm going to say our little conclusion. So, proper placement of urinary catheter is an essential healthcare procedure that must be performed accurately, respectfully, and with consideration for the patient's physical and emotional needs. As a nurses, it is essential to have the necessary knowledge and skills to perform this intervention safely and effectively, minimizing the risk of infection of complications. And then I think the most important thing is effective communications with the patients, because we're having a little procedure that is invasive to the patient. So effective communications plays a key role in the process, because explaining the procedure, addressing concerns, and creating an environment of trust not only facilitates the procedure, but also helps reduce anxiety and improves the patient experience. So comprehensive care combining proper technique with a clear and empathic communication is a crucial to ensure patient safety and well-being through the process. This is our reference, and thank you for listening to us, and have a nice week. Bye-bye.